Welcome back to the Path of Longevity show, and I'm your host, Dr. Robert Lufkin, and I'm joined by my co-host, Dr. Steven Sidoroff.
Before we begin, I want to take a moment to tell you about some new free online masterclasses that Steve and I are offering. For example, we know that inflammation drives all chronic diseases and aging. That's why it's called inflammaging. But we're now learning that this inflammaging can be reversed. And one of our masterclasses will spell out the top 4 ways to reverse it. If you're interested, see the link in the show notes. And now back to this week's episode.
And I'm very pleased in this session to have with me Kevin Ellis, known as the Bone Coach, and also developer of the program called Stronger Bones Solution. Welcome, Kevin. Pleasure to have you here.
Steve, it's a pleasure to be here. I'm looking forward to this. I think it's going to be a great conversation.
Great, great. Well, let's start by giving our audience, what led you on this journey into helping women with osteoporosis?
Yeah, it's not typically the young male that you're thinking about when you're thinking about osteoporosis, but for me, I would say my health journey is what brought me into this and having my own diagnosis of osteoporosis. But really, my health journey started when I was much younger, when my mother was 5 months pregnant with me. My father was told he had cancer. 2 months after I was born, he passed away. He was 35 years old at that time. He was a Marine in Vietnam. He did 22 months, and then he ended up getting cancer from Agent Orange, of all things. When I left the Marine Corps, after I became a Marine, left the Marine Corps, I actually started having all these different health issues. And I had high stress, poor sleep. Some days I could barely even get out of bed. Energy was almost non-existent, digestive issues. And then I was diagnosed with celiac disease. So I was malabsorbing nutrients for many, many years. And then I was subsequently diagnosed with osteoporosis right around 30 years old. And at this point, I've got kids on the way, and I'm just worried that I'm headed down the path of my father, who passed away at a really young age and wasn't able to be there, for me long into the future. So I had a pretty strong impetus for making some improvements and changes. And I just remember when I was diagnosed, I was given this letter in the mail that said, hey, you have osteoporosis, go on a gluten-free diet. And I knew there was so much more that had to be done at that point. And that's where I got into the research and the reading and consulting people. And I realized through my own health journey of improving my health and my bones and things like that, that it's usually the woman 50 to 60 plus that needs the most help. And that's how I got into the field of becoming a coach, building out a team of credentialed experts, and then developing a program that has helped people now in over 1,500 cities around the world. And we've got over 100,000 people that are thriving in our community. So it's really awesome to see the impact that has had. And it's not just about helping people have stronger bones. It's about helping people live longer and have better quality lives later in life.
Mm-hmm. Well, I can really appreciate that. I've come across a lot of people in their older ages who stop a lot of different kinds of physical activities because they've been given that kind of diagnosis, and then they're afraid. My father was stopped riding a bicycle because he was afraid of falling and breaking his bones. So this is such an important issue as the population gets older. But why don't you tell us what is the definition of osteoporosis, and how common is it?
Yeah, it's low bone density is actually pretty common. I mean, if we're just looking at the US, obviously global numbers are going to be higher, but if we're just looking at the US, we've got approximately 10 million Americans that have osteoporosis, and we've got about another 44 million people that have low bone density. And the statistics behind that, 1 in 2 women, up to 1 in 4 men will break a bone in their lifetime due to osteoporosis. For women, the incidence of low bone density is greater than that of heart attack, stroke, breast cancer combined, right? And then if we've got hip fractures, about 300,000 hip fracture patients every single year, and a quarter of them end up in nursing homes and never regain that previous function. So it's an issue that if we realize we have it, we need to address it. Now, osteoporosis literally means porous bone. And it's a condition that's characterized by either not enough bone formation, excessive bone loss, or it's a combination of the two of those things. And in osteoporosis, both your bone density and your bone quality are reduced, and that's going to increase your risk of fracture. Now, the way you find out you have osteoporosis is through what's called a DEXA scan, or a bone density scan. That's dual energy X-ray absorptiometry, painless test, kind of like an X-ray, low levels of radiation, but you lay down on it, it does a scan, and it tells you your bone mineral density, the actual mineral content of your bone. And then it generates a score. And that score is called a T-score. And the T-score is comparing your bone density to that of a healthy, approximately 30-year-old adult. If you've got a score of +1 or -1 or somewhere in that range, that's considered normal and healthy. If you're -1 to -2.5 or in between there, that's considered osteopenia, which we would call low bone mass, which is like a precursor to osteoporosis. And -2.5 or lower, so -2.6, 2.7, so on and so forth, that's considered osteoporosis. The greater that negative number becomes, the more severe the osteoporosis. And most people are getting a bone density scan later on in life, 50s, 60s, 70s. That's the first time they've had one. I encourage people, if you haven't had one, get one done earlier. Get an objective baseline done earlier so you can monitor future changes from that.
Mm-hmm. Yeah, I always believe it's important to get on whatever we're measuring, get baselines so that when something starts to happen, you have a comparison to where it had been. So I can appreciate that. And I think based on, what you're just saying, that this is such an important conversation here in our summit, because really we're not only looking at longevity and lifespan, but we're also very interested in health span. And that's living the best possible life as close to the end of your life as possible. So this is a very important subject. Can you give us some notion of what causes osteoporosis?
Yeah, I mean, there are different types. I think it's important to distinguish between the types of osteoporosis, because there's primary osteoporosis. That's typically related to a decrease in estrogen in postmenopausal women. Estrogen has a protective effect on bone. When those levels decrease, as they do during menopause, so I think it's important to distinguish between the two different types of osteoporosis. There's primary osteoporosis. That's typically related to a decrease in estrogen in postmenopausal women. Estrogen has a protective effect on bone. As estrogen levels decrease, as they do during menopause, that causes an increase in the activity level of cells that break down bone. But then there's a whole nother cause of osteoporosis, and that's where it occurs as a result of behaviors, disorders, diseases, conditions, and medications. All of those things can also contribute to bone loss. An important note we need to make here is that just because someone is a postmenopausal woman does not mean that is the sole cause of their bone loss. It could be more than just hormones, and there could be another cause. So what could some of those things be? I think before we actually talk about the things that contribute to bone loss, we need to understand that it could have been also that we didn't reach peak bone mass in our younger years. Up to 90% of your bones Where did you lose me at there?
90% of your bone.
Okay. Before we talk about what actually causes and contributes to bone loss, I think we also need to talk about that you may just not have built up enough bone in your younger years. So up to 90% of your bone mass is put on by the time you turn age 18. And the remaining 10% approximately fills in by the time you turn 30. So if when you were younger, you had poor diet and nutrition, you didn't get enough calcium and vitamin D and magnesium and vitamin K2, or you ate a bunch of sugary candy or drank a bunch of sugary soft drinks, or you just didn't have the right diet and nutrition. Or if you led a sedentary lifestyle, you weren't doing resistance training or playing sports or doing gymnastics or those kinds of things when you were younger. Or you smoked or drank excessively. You had an eating disorder. You took certain medications like glucocorticoids. We'll talk about those in a minute. All of those things could have contributed to you not reaching peak bone mass and starting with what I call a full bucket. So then come fast forward to later on in life.
Let me just check in with you here. I'm wondering, as you indicate these various causes, what about like psychological stress and trauma? Does that play a role?
Such an important role. And it's an overlooked contributor also, because the experiences that we have in our later years will affect your health, your skeleton. You will internalize those things and they'll manifest themselves in your health throughout your life. So it's really important to understand that the traumas we do have as kids can actually show up as health conditions later on in our life. But stress in general, it's not always a physical stressor that can contribute to that bone loss. It could be the psychological stress, the fear, the worry, the emotionally charged thoughts, the family conflict, the financial challenges, keeping up with the perfect lives of the Joneses on social media. All of those things can contribute to and drive that stress response. It's not that the stress response is a bad thing. It's just if we're in that mode, that fight or flight mode too often and too much, that's when we're going to have issues.
Right.
But yeah, some of the other contributors to bone loss, now that we've talked about some of the other things like not achieving peak bone mass, one of the other contributors could be medications that someone is taking. And some of those medications, I think one of the most important ones that people need to be aware of are glucocorticoid medications. Now, these are steroid medications that are designed to suppress inflammation, and they mimic natural steroid hormones in your body. And they're used to treat conditions like rheumatoid arthritis, like asthma. You may know them as prednisone, cortisone. We have to understand, if you take these medications, bone loss will happen, okay? And it's going to happen for a few reasons. The first reason is that it increases your urinary excretion of calcium. It's going to inhibit intestinal absorption of calcium. And the biggest effect is from the glucocorticoids acting directly on the cells that break down bone, the osteoclasts, to increase their lifespan. And that is going to reduce your bone density. So the most precipitous bone loss is going to take place in the first, the first couple months of use. But if you continue on with it, you just have to be aware that's going to lead to bone loss.
Yeah. And Kevin, let me interrupt for a moment, because you mentioned inflammation. Is there a connection between inflammation and bone loss?
There's a major connection between inflammation and bone loss. I think we need to understand too, that when it comes to your bones, they're not just these static tissues that hold us up and give us structure. They do that, and they do it really well, right? But in the very center of your bones, you have something called bone marrow. And bone marrow is a soft, spongy material that produces blood cells. So 95% of your body's blood cells are made in the bone marrow. Blood cells are going to start out as stem cells, and these stem cells are going to become either platelets or red blood cells or white blood cells based on conditions in your body. I'm going to tie this to inflammation in just a second. So if we need to prevent or stop bleeding and we need help with clotting, platelets are going to help with that. When we need to carry oxygen from the lungs to the body's tissues, carry carbon dioxide away from the tissues back to the lungs, red blood cells are going to help with that. If we need help fighting infections, healing wounds, anything immune related, that's where those white blood cells are going to come in to help out. Now, to take it a step further with your bones, anything that talks to the immune system, and those white blood cells can also talk to your bone health, your bone cells. So your bone cells, those osteoclasts, are actually going to come from white blood cells, or right from that area. So you can actually, if you're stimulating the immune system and you've got these things contributing long-term, especially things like inflammation too, those can contribute to bone loss and osteoporosis. So we have to be aware of that.
Mhm. Great, great. What is the typical treatment for osteoporosis?
The standard treatment for osteoporosis would be when you're in that doctor's appointment and you're told, hey, you have osteoporosis. In about 15 minutes, the recommendation is going to be take some calcium, take some vitamin D, go for a walk, and here's a bone drug. And that is woefully inadequate. And I always liken the use of these medications to the old economic adage, there's no such thing as a free lunch, right? There's a risk, short and long-term implications of use. There's side effects that come with these medications. And there are two different categories of medications that will be proposed to somebody when they're diagnosed with osteoporosis. There are anti-resorptives and there are anabolics. Anti-resorptives would be your bisphosphonates, like Fosamax, Reclast, Boniva, those kind of drugs. And then your rank ligand inhibitors like Prolia. Those drugs, those anti-resorptive drugs, they're designed to slow down the activity level of cells that break down bone. But then what they do, they can do that. But what we have to be aware of is that for bisphosphonates, the safety and efficacy of these drugs is not really well known beyond 5 years. And as you and I are going about our daily lives, doing our daily activities, exercising even, we're starting to accumulate tiny little micro cracks, micro damage in our bones. That's normal. And then what happens is we have cells within the bone called osteocytes that sense that damage, and they send a signal to the other bone cells. And the other bone cells, the osteoclasts, come in and they scoop out that damaged bone. And it's a coupled process. Right behind it, we've got the osteoblasts that come in and build and form stronger, healthier bone. You can actually slow down that activity level too much to where you start to accumulate that old, worn, damaged, weakened bone. So even if your bone density is showing higher on a scan while taking one of these medications, it may not actually be stronger, better quality bone. Really important to understand that. And then for the rank ligand inhibitors like Prolia, once you get on that medication, if you come off of it, your risk of vertebral fractures actually increases significantly. The other category of medication is anabolics. And these drugs are designed to build bone, build better quality bone, and build it faster. And they can do that. And they can do that well, as long as you don't have an underlying contributing factor. But we have to be aware that if you take this medication, you can only take it for a certain period of time. And here's the kicker. You have to follow it with another drug, an anti-resorptive, just to not lose the gains you just had. So a lot of times you have to understand, you're not just committing to one medication now, you may be committing to multiple medications for years to a lifetime.
Oh, yeah. So there's, as you say, no free lunch. Each of these medications has its downside.
Mm-hmm.
Yeah.
Yep. Each of them has different side effects. A lot of times what people tell me is sometimes if they've taken these medications that they'll have, full body reaction where their body just rejects it and they're just in a lot of pain. Or if they've already got digestive issues, sometimes it accelerates or makes those digestive issues worse. In terms of some of the other ones that come with bisphosphonate use, for example, I think the biggest concerns that people have are osteonecrosis of the jaw, and that's where the jawbone begins to starve from a lack of blood. Basically, you have cells in the jawbone that are going to start to die. And then, there are other ones too that I think atypical femoral fractures. Those are ones that people are concerned about as well.
So before we go into some remedies to these situations, can you share, is there a connection between gut health and bone health?
There's a major connection between gut health and bone health. I always tell people to think of their bodies and their bones as being like plants, right? In order to grow, you need nutrients in the right conditions, right? So many people focus so much on the nutrients, the salads, the smoothies, the supplements, they fail to consider the soil. And your gut is like the soil. You're absorbing almost everything there. So when you take in food in your mouth, you start to mechanically break that down into smaller pieces, and then it goes to your stomach. It's churned in this acidic mix to break it down even further. Then it makes its way to your small intestine. what we would call your soil, right? And you're absorbing almost everything here. So when you down there, you need roots in your soil. And these roots are called villi. They're these tiny little hair-like projections that are responsible for absorbing nutrients from the food you eat. And what they do is they shuttle those nutrients to where they're needed in the body, whether that's growing your hair or, healing a cut on your hand or rebuilding stronger bones. The job of these villi is so important that the total surface area they use to absorb nutrients is the size of a football field, which is pretty amazing. So we know that that's important. If you are not able to, if your roots are damaged, right? If they're damaged or they're blunted or you can't absorb those nutrients, your body still needs those nutrients to execute its daily functions. So where is it going to go? It's going to go to the largest reserve of minerals that you have, which are your bones, and it's going to pull from there. And that's how somebody that has, is 30 or 40 years old that has celiac disease or digestive issues can wind up with osteoporosis.
Wow.
So that's one way. But then also it could be that we've got good bugs in your soil, but maybe they're in the wrong place. So SIBO, small intestinal bacterial overgrowth, or you could have some gut infections, or maybe it's Crohn's or ulcerative colitis or some other condition. Or if you've just got chronic loose stools, right? That's an indicator that there's probably something else there that needs to be addressed. And it's not just about absorption. Those digestive issues themselves can be a source of inflammation that contributes to bone breakdown in the body.
Is there a perfect diet? Can you describe what's the best diet for someone with osteoporosis or someone wanting to avoid, prevent?
Yeah, no, and that's such a good question. I get asked that all the time, which is we're all biochemically and genetically unique individuals, right? We're going to respond to different foods and supplements and dietary approaches differently. There's no one blanket approach for every single person or one single superfood for every single person that's going to work. Because if it creates inflammation in your body, it's not a health food for you. So I think that's important to note, is that if you see this superfood, that, and I should be taking this because I saw it in some Facebook group or something like that, make note of it. It could be helpful, especially if the research is there to support it. But if it doesn't work for you, just know that it creates inflammation, it's probably not going to be the right fit. There are some foods that I do like to see people incorporate in their plan if they can. One of those is fish, but not just any kind of fish. I like to see people incorporate the sardines, mackerel, salmon. Wild sockeye salmon is great too, or other kinds of wild salmon. But get the kind with the bones in. You can get canned sardines or mackerel even in a BPA-free can, but that have the bones in. And the reason you want the bones in is that they contain protein. So your muscles need protein, your bones need protein. Your bones are actually 50% protein by volume. So they have to have protein and amino acids. The other part is these fish contain minerals and nutrients. And the great part about it is they don't just contain calcium. They contain all the minerals and nutrients your bones need. I'm back. Okay. The other fish that I really like are sardines and mackerel and salmon, like wild sockeye salmon. And I like these fish that are in the cans, BPA-free cans, with the bones in them. The reason I like the bones in are for a few reasons. Number one, these fish contain protein. Your bones are 50% protein by volume. They need amino acids. Your muscles need protein as well. So that's a great one. They contain minerals and other nutrients. They don't just contain calcium by themselves. They contain all the minerals and nutrients that your own bones need in the right ratios that nature put them in. And then I like that it has omega-3s. And omega-3s are fatty acids, but they're also like dampeners of inflammation. Remember, anything that's contributing to inflammation, especially chronic, especially long-term, That's going to contribute to and fuel bone loss. And another food that I really like is arugula. Arugula is one of my absolute favorite greens. And the reason for that is it's in the same cruciferous family of vegetables as broccoli and kale. It contains vitamin C, vitamin K, and bioavailable calcium, all of which are important for bone health. It also contains a bioactive compound called erosin, which helps turn off the activity level of cells that break down bone. And it's a low oxalate green too. And a lot of times if somebody has digestive issues, they have kidney stones, they have a lot of joint pain, that may be an indicator they have a hard time breaking down and degrading oxalate. So you can swap out spinach or other high oxalate greens for that arugula in those situations. And I think one of the last foods I think would be important to put in there would be vitamin C rich foods. I think all of us understand how important vitamin C is for our health. We hear it for everything, including our immune system and inflammation and all these other things. But for our bones, it helps stimulate procollagen, enhance collagen synthesis, and stimulate alkaline phosphatase activity, which is a marker for bone building cell formation, which is pretty cool. So you can get it from lots of fruits. In terms of berries are great sources. Citrus fruits like your lemons, your limes, kakadu plums, acerola cherries, amla, camu, those could all be good sources of vitamin C. And then some vegetables too. Your peppers, those are your highest sources of vitamin C for vegetables. If you are following a diet that doesn't include the nightshades, then you're probably not going to include those peppers. But you could also do steamed broccoli or some lacinato or dino kale or some Brussels sprouts. Those are some other ways to get some vitamin C rich foods into your plan.
So are we talking about being able to reverse osteoporosis or just slow its progression?
Great question. And so many people, when they come to us, that's what they're asking. Can I reverse osteoporosis? You can build bone density and bone strength. You can absolutely do that. I always tell people not to focus on reversal because that can be a little misleading sometimes. Because if we're just looking at the number, hold on just a sec. I think I'm back. You know what? This has been a real pain these past few days, but I'm glad. Thanks for your patience. Okay, I'll start right at the beginning, back in terms of reversing osteoporosis. That's a great question about reversing osteoporosis. So many people come to us and they ask us, hey, can I reverse osteoporosis? You can build bone density and improve your bone strength. You can absolutely do that. What I always encourage people to do is not necessarily focus on just reversing osteoporosis, but focus on the actionable things that you can affect the outcome of. And because if you can break that goal of reversal down into all these different steps that you can actually affect the outcome of, that's going to make it more realistic. And I think the best place to start is you can't start going up and improving if you're still going down and losing. So if you still have active bone loss right now, the goal is not reverse osteoporosis. The goal is, what is the root cause and how can I address that root cause to slow or stop or prevent more bone loss? So we have to shift our focus. You don't want to get too far ahead of yourself. Right. And then the next part of that is, a lot of times people just look at the bone density scan that we talked about earlier. Bone density scans are important, but they're a lagging indicator of success. They're only done 1 or 2 years later down the road because the improvements that you would see in bone in that given time period are the realistic improvements. That's how long it's going to take to see those improvements. So we need to look at leading indicators of success. One of the best things you can look at is you can actually look at the activity level of cells that break down bone. You can see if you have active bone loss right now. There's a test called the serum CTX. It's called the CT low peptide test. It's a blood test. And this test can tell you the activity level of cells that break down bone. And if that activity level is elevated or even really high, that can be an indicator of a root cause issue that needs to be addressed. So I always tell people, start there, and then you focus on the diet, the digestion, the absorption, the stress, the sleep, the exercise, the hormones, all that kind of stuff too.
Yeah. Well, that's what I always recommend to the people I work with, one step at a time, and foundation first, take care of the foundation first. Let's shift into exercise. Can you share about how big a role exercise plays in bone health?
It plays such an important role. And so many people don't realize how important of a role it plays, because you can do all the things we were just talking about. You can eat as many sardines and mackerel and arugula and vitamin C rich foods, and you can get your gut health squared away, and you can reduce your stress and all that stuff. But if you do not provide your bones with the stimulus they need to become stronger, you will not build stronger bones. Okay. So a lot of times when people are, like I said, when they're told they get the diagnosis, it's just, hey, if you want stronger bones, go for a walk or do some weight bearing exercise. I can tell you right now, going for a walk is not enough. Okay. Mm-hmm. It can help you maintain the low, at least in the lower half of your body, your bone density. It won't help you build, but it's just not enough. You need two different types of stimuli for your bones. You need muscle pulling on bone, and you need impact. When muscle pulls on bone, there's a mechanical signal that sends a chemical signal to tell those bones to become stronger. Mm-hmm. Then you have impact also, which is important. Let's even just talk about what is weight-bearing exercise, because I know a lot of people hear that and they're like, well, what is that? That's where your body and your bones have to work against gravity to keep you upright. And those are exercises that you're doing, and they're placing a good, healthy stress on your bones. So this would be like you're running, you're jogging, you're hiking, you're dancing, you're gardening, you're playing with the kids or the grandkids out in the yard. Or it could also be your yoga, your Tai Chi, your Pilates, those kinds of things. Those are all weight-bearing exercises. Now, the other thing is we've got non-weight-bearing exercises that sometimes people do. And it's not to say that you can't do these things, just to say there has to be more. Mm-hmm. So non-weight-bearing exercise are where your body and your bones don't have to work against gravity, and you're not placing that good, healthy stress on your bones. This would be your cycling, your kayaking, or your, this is a big one, swimming. Swimming is probably the biggest one. And the reason for that, and astronauts struggle with this too, when they go up into space, they don't have gravity working against them. They're not placing that stress on their bones, and they lose bone mass significantly, right? You don't use it, you lose it. So it's not to say don't do those exercises or don't ride your bike if you want or go swimming if you want. If they make you happy and you enjoy them and you're doing a part of family activity and they reduce your stress, that's okay to incorporate them. So, but you got to go ahead. Yeah.
Yeah. So I'm a mountain biker, and I know when I'm going up a hill, I'm really pushing hard on those pedals. That's not weight bearing to be pushing hard on those pedals.
See, and that might be a little bit different, right? There could be a little bit more stress being put there. There's probably going to be more stress being put there on the bones than just like a casual bike riding, or even just flat surface endurance riding and things like that. Mm-hmm. Which doing that too much could actually have a negative impact on bone density. So what's really important is bringing and incorporating in this next part of training, which is resistance exercise, resistance training. And that's where we're bringing in, resistance bands or barbells or dumbbells and things like that. And we're incorporating exercises like squats or deadlifts or chin-ups with maybe, to get a little impact in there, we do a little drop, you do a little drop landing safely, or overhead presses. Even those kinds of things can really help you. And then you can start to get to a point where you're providing the stimulus your bones need to become stronger. And if those exercises sound intimidating to people, don't let them be. It doesn't mean you have to go on YouTube, find the first deadlift video and go start cranking out some reps. Don't do that. Okay. You want to work with somebody that looks at your body mechanics, can help you figure out what's the right approach for you, and then can help you slowly progress up to the point where you're providing the stimulus you need safely. It's not a race, right? It's not just, let me give it the greatest effective dose as hard as I possibly can in the first week or two, because that can lead to injury. So be patient with yourself, do things over time, and just be kind to yourself as you're going through this process.
I was speaking at a longevity conference recently, and there was a device that was demonstrated where a person was sort of on their back and pushing up like a leg press device. And they had data showing how impactful that was in terms of improving osteoporosis. Are you familiar with that or similar kinds of devices?
That's probably like osteogenic loading. It was like a device like that where there's it's a static machine, but you're putting 4.2 times your body weight. Oh, I'm freezing. I'm back. Give me just a second here. Can you hear me okay?
Yeah, we're giving Rob a lot of extra work here, but he doesn't mind.
I know. Sorry about that, Rob. Okay. So I think the device you're talking about it's probably related to osteogenic loading. Okay. Now, osteogenic loading is it's based on the work of Julius Wolff, and that's where we're applying the force of, you're loading the bone through its axis to stimulate that bone to become stronger in density and strength. So you're inducing structural adaptation in bone. And what they're doing is you've usually have a couple different machines that can help you do that. There's one for your spine that you're doing. There's another one where you're pressing against something. There's another one where there's a leg press. And all of these things, I would just say it can be helpful to incorporate things like this, but I wouldn't have it fully replace an exercise plan, right? So it could be a complement, but it can't just be a replacement for a full exercise plan. And then also, you've got to be really careful if you are somebody who already has osteoporosis and you've got poor quality bone. And I'll talk about quality. Density is what your DEXA scan tells you, your bone density scan tells you. That's the actual mineral content of your bone. What it doesn't tell you is the quality of your bone, the structural integrity, the microarchitecture, how that bone is organized. Those two things combine to create bone strength. So if you have really poor microarchitecture and poor quality in your bone, and then you go load this really heavy load onto it, that may not be the best thing for you. That could actually increase the risk of fracture. So just weigh some of these things. In general, though, I would say it can be a complement, but not a replacement.
Right. And so what do you say to a person who's afraid to exercise because they're afraid that they're going to fracture one of their bones?
Yeah, it's important. I mean, work with people that know what they're doing. That would probably be the first thing I would say is understand that there are certain exercises that can increase your risk of fracture, and understanding exactly what those exercises are and how to make adjustments so you're not putting yourself in a compromised position and increasing your risk of fracture. So knowing those things ahead of time before you actually get into doing your exercise program, that's probably going to be the best approach. I don't think a lot of times people are told when they get osteoporosis, oh, well, don't even put a backpack on, or use really light weights, or go the opposite direction of what they actually should be doing in most cases. Just know that just because you have osteoporosis does not mean that you are just fragile and are going to fall apart. You can still apply some stimulus to your bones, but you want to have a little more data about the quality and the density before you start doing things.
Right, right. Well, this has been a really wonderful conversation and discussion. I think this is important for everybody who's, as I said earlier, interested in health span, not only lifespan, but to summarize, can you say what a Stronger Bones program or plan looks like, Kevin?
Absolutely. So first thing you have to do is you have to identify and address root cause issues of bone loss. You need to know what test to order, know how to have those conversations with your doctor, get to the root cause issues of things, reduce that bone loss, slow, stop, prevent more loss. That has to be the first part of this. Then the next part of this, and some of these happen in tandem too. The next part of this is nourish. You need to restore the raw materials and the nutrients that you need for stronger, healthier bones through diet, through digestion, through absorption. You need to take in the right nutrients in the right amounts. You need to actually absorb those nutrients, and those nutrients need to make it to the cell level. A lot of times when people are eating healthy, they still might not be hitting that first layer, or all three of those things might not line up. And the third part of this is build. You have to build strength of body, strength of mind, strength of bone in a way that prevents fracture and injury. You need to reduce your stress, improve your sleep. I mean, of all the health things that you can do, improving your sleep is probably going to be one of the most impactful things you can do. It's pretty well documented that poor sleep will reduce your bone quality. And then optimize hormones, and then get the right exercise plan in place to provide the stimulus you need to become stronger. All of those things come together, and that is what contributes to all of those things come together, and that's what contributes to a Stronger Bones plan.
Beautiful, beautiful. Well, Kevin, thank you so much for your very valuable information. I'm appreciating our conversation. Can you let our listeners know how they can reach you?
Absolutely. So you can always find me at bonecoach.com. Really easy at bonecoach.com. You can always find me there. And then we're actually on Facebook at Bone Coach, YouTube at Bone Coach, Instagram at Bone Coach Kevin, and some of the other sites there. And we have a podcast too. So you can always find the Bone Coach podcast. Those are the best places, but bonecoach.com is a good start.
Great, great. Well, thanks again, Kevin. Really appreciate the conversation.
This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine or the provision of healthcare, diagnosis, or treatment, or the creation of a physician, patient, or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time.